Hello, my name's Lisa Bryan and I'm the Prevention, Safeguarding and Partnerships Manager at Northamptonshire Fire and Rescue Service. I'm going to talk to you about how we work with people who may be experiencing self-neglect. This is a challenging area for everyone involved. An adult's ability to maintain their physical and mental health and their physical environment can be affected by a range of complex issues related to their life experience. Not everybody has the same idea of what self-neglect is, so here are a few examples. Excessive alcohol or substance misuse, under or overeating, poor levels of personal hygiene resulting in skin infections, pressure ulcers for example, refusing medication or medical treatment such as insulin for diabetes or treatment of leg ulcers, unsanitary conditions resulting in risk of infestation and disease, poor living conditions such as poor heating or lighting in the home, hoarding and a very cluttered environment, keeping lots of pets who are poorly cared for, poor finance management such as household bills not being paid, leading to utilities being cut off. And if an adult who is self-neglecting has responsibility for a child, the child could be at risk of suffering abuse and neglect as well. The adult concerned may not recognise that they're self-neglecting or the risks being taken, and they may decline to engage or to make any changes. Don't walk away from the situation, as it could get worse. The Care Act 2014 statutory guidance includes information on self-neglect in the categories of abuse or neglect relevant to safeguarding adults with care and support needs. In some circumstances, where there is a serious risk to the health and well-being of an adult, it may be appropriate to raise a safeguarding concern because of self-neglect. Working with self-neglect involves finding the right balance between respecting a person's independence and a right to privacy against fulfilling your own duty to protect the adult's safety. Assessing the adult's mental capacity is an integral part of this. Assessing the person's mental capacity while they are resistant or suspicious of outside intervention can be challenging. Research undertaken by the Social Care Institute for Excellence indicates that intervening successfully depends on practitioners taking time to gain the person's trust and build a relationship. This might not be a quick process and involves going at the person's own pace. It may take some time to achieve the best outcomes, but again, don't walk away from the situation. If you have concerns regarding the person's self-neglecting behaviours, it's your responsibility as a practitioner to raise these with the adult and seek their views. Identify any other agencies involved, share information, and ensure a multi-agency approach is taken to develop a risk management plan. This could involve starting Northamptonshire's adult risk management process. The risk to individuals can be high, with some cases of self-neglect leading to significant harm and even death. Taking the balance of rights and risk into account, if the risks are felt to be significant, we as practitioners have a responsibility to raise a safeguarding concern. The local safeguarding interagency procedures provide a robust framework to support risk assessment and decision making. Throughout all of this, it's imperative to establish and take account of the adult's views in line with making safeguarding personal. Some people may refuse to accept care and support. Therefore, agencies must be able to evidence in writing their risk assessment and their proposed management plan, and that information and advice were made available to the adult on how to access care and support in the future. So what works well? It may be that the first few times trying to engage the adult doesn't work. Again, please don't walk away. Research and our own experience tells us that multi-agency working generally gets the best outcomes for everyone involved. This often involves working with a range of agencies such as the adult's GP, community health staff such as district nurses, family members, friends, neighbours, carers, advocacy, voluntary organisations, environmental health, housing, and emergency and legal services. Some agencies may have more impact in certain situations, such as the fire service where I work, and we may be able to emphasise the fire risk to an adult and their neighbours in cases of smoking, alcohol misuse and hoarding. Really think about who the best person would be to engage with the adult. This may not be a professional, maybe a neighbour or a friend. Sometimes repeated intervention is required. Whilst progress may be slow, it's important to try and engage with the adult as best as you can. Work with colleagues collaboratively and continually risk assess, ensuring any action is proportionate to the level of risk. Refer to your own agency's Safeguarding Adult procedures and the Northampton Safeguarding Adult Board interagency policy and procedure. This will optimise the safety and well-being of the adult as best as you can. Ensure colleagues are involved in multi-agency working, such as using the ARM process to agree an appropriate method to monitor the situation. So, here are your 4 messages to take away. Continually risk assess the situation, make a safeguarding referral if the adult has care and support needs, is experiencing or at risk of neglect and is unable to protect themselves. A multi-agency approach works best. Consider starting an ARM. Identify someone in the multi-agency group or ARM meeting who is best placed to take the time to build on their relationship with the adult. And most importantly, don't walk away. Work with your colleagues to support the adult. Thank you.